We have seen you guys in our DMs, and so we finally put together a slew of questions that you had for us.
I have such mixed feelings about this.
I'm scared of looking fake with Botox. Can I look natural and still get benefit?
What's the difference between lip filler and a lip flip?
A whole lot.
And you can't talk.
Why do people call Sculptra the 401k for your face?
Welcome to Fill and Tell, where we spill the tea on all things aesthetics.
We're your hosts. I'm Megan.
And I'm Lauren.
We're here to give you the inside scoop on what goes on behind the treatment room door.
From filler to facelifts, skincare to aesthetic secrets.
We're taking you behind the scenes of the industry with unfiltered conversations, expert insights, and maybe a little gossip along the way. We have seen you guys in our DMs, and so we finally put together a slew of questions that you had for us, whether you're too scared to ask your injector, or maybe you just forget because you guys are chit-chatting like we do with our patients. Hopefully this answers quite a bit of questions that you have, any concerns. So let's dive right into it.
Yeah, let's just start it off. How long does it take to see results from a skincare routine?
So if you're looking for a quick fix, I think like our exfoliating, pads and things like that can be overnight.
Absolutely.
But
I love the Skin Better pill pads, and I love the Jordan Harper exfoliating pads. I always tell patients, if you want to see results super quick within a week, add in a pad. But typically, like a standard skincare routine, I say 2 to 6 weeks for you to really see results. I've seen people back at 2-week appointments where I'm like, wow,
I think
did amazing.
I think on the outside, externally, you can start to see more brightness, but I think the standard for like retinoids is like 8 to 12 weeks.
Yeah.
And
That's
then
gonna be a little bit
for
longer.
like that general luminosity that you carry on for like vitamin C's is going to be like 8 to 12 too.
Yeah, and really just sticking with the routine. I think a lot of people, you can, especially if you haven't been using stuff before, you can go through a little bit of a purge. That doesn't mean you're allergic. It doesn't mean anything like that. If you are just new to quality products, you do sometimes have to go through a little bit of a introductory phase. So stick it out. Normally it's worth it. Certainly if you have redness, irritation, burning, things like that, you could have some sort of sensitivity. But for the most part, 6 to 12 weeks for good at-home results.
Well, to your point, I think if you're not on a good routine and you start incorporating these great skincare products, you'll probably notice something quickly. More quick.
I know.
Just because they're great products. Okay. Does it really matter medical grade versus over the counter?
I have such mixed feelings about this.
No, I think it does. I think that there is a technology in our medical grade products. I know. We know that there is a different technology that has been studied in these medical grade products that probably hits the dermis, where collagen, where your pigment is.
Some.
Versus over the counter are good for like moisturizing and hydrating, but also their potency is not as strong as medical grade.
Correct. You can't always get the same percentage. Like Skin Better Alpharet, they're putting in a 0.025 retinoic acid, which is your prescription Retin-A, in their product. And their delivery system is truly unlike anyone else's, which is why they have such a standout product. I don't necessarily know that some of the products out there should be charged for what they are, though. There was that whole thing with SkinCeuticals, CE, patent of L-ascorbic acid, mixing it with ferulic and vitamin E, and like everyone else is doing that too, and you're charging $185. Is that special? I don't know. I don't think so.
Yeah, I don't know. I don't know. I guess that's one of my holy grail products, so I feel like I've seen so much change with it. But yeah, I mean, here's what I think is that, yes, you can say their patent is gone and you can remake it, but I do think that there's a stabilization that
you gotta drop the pH, but a lot of people can do that.
They can, but I don't think that you can say we have the same ingredients, the same formulation as CE, but maybe you're just you're missing the mark somewhere. I don't know.
I mean, I don't know that you're getting the same results with ordinary vitamin C as you are with SkinCeuticals, but I think that you're getting really high quality vitamin C with maybe some other ingredients. That's just one that's off the top of my head.
So if you have the money or if you're willing to invest, I think that there are a few products you should invest within the medical grade realm, because we do know that the potency is there, the technology usually for it to really drive into your skin and get to that dermal layer is there. You'll probably see results quicker
for sure,
because of all of those things. If you don't have the funds, I think you can still get away with a great skin regimen, specifically just wearing sunscreen every day. But
so vitamin C, I think retinoid, pigment products, even HA. I feel like there's a lot of HAs on the market that just will sit.
Yes, and that's why I love like the Hydrinity HA.
Yeah.
What's another
the
one?
The Ourself HA.
Yes, because these really are dual weight HA. So here again is that technology.
Yeah. There's some variations in pricing. You don't have to go La Mer moisturizer for $300,
which I wouldn't anyways.
Why would you? But, you know, we could step it up from some of these, you know, $6 drugstore options as well. There's a range.
Yeah.
There's a time and a place for everything. That was, you know, that one's always a really controversial vitamin C to bring up.
And don't get me wrong, I think that over the counter there are plenty of products that I recommend to my patients daily. I don't think you have to necessarily splurge on a cleanser or a moisturizer.
But when you do, you realize that they kind of are better.
Agree.
I mean, like, because I love my Prequel glycerin cleanser, but like when I use my Prelude, I love it more. When I use my Revision, I love it more. When I use my actually, I really love the Prequel half and half moisturizer, but there is just something a little bit more luxurious about it. Mm-hmm. So when you can do it.
And then I wanted to you just reminded me of, speaking on price point.
Mm-hmm.
Like, for instance, Epicutis is a higher price point, but they actually have white papers that explain their science.
And so minimal ingredients. Like if you're really conscious about what you're using and what you're putting on your skin, a lot of their ingredients are 8 max.
Yeah, I love it.
It's amazing. Okay, do I really need to wear sunscreen every day, even if I work indoors?
Yes, the short answer is yes. There have been
move on. Just kidding.
There have been some studies that show even if you like are indoor in a
hello, look at us right now. We're sitting right by this window.
Yeah.
We've had light in our faces for the last 3 hours.
Yeah.
And yes, you should be wearing sunscreen.
Well, there's been some studies that show the wearing sunscreen, whether you're indoors all the time or not, it improves your skin.
Yes. Yeah.
So, and then just a little take on indoor. That's why we like to use a mineral-based sunscreen, tinted sunscreen.
Tinted, yeah.
Because of the iron oxides, they protect against visible light and blue light. And so that can protect you against your phone. All of that blue light that comes from our phones and our computers. Now that we use them so often, there's studies that have come out that shows that light damages our skin.
Yeah, and blue light comes from the sun as well. When you're on an airplane, you get way more UV exposure sitting with your window open on an airplane. So just making sure you're always. It's just, we say every day because it's beneficial every day, but also it gets you into the routine of putting it on every day, no matter what.
I agree.
If I'm going to put on makeup, maybe I put on a tinted, but it's a little bit more lightweight. If I'm going to go play tennis, maybe I'm going to put on like a thicker one that's not going to run while I'm sweating so much. So like have a couple in your arsenal that you love, but yes, every single day.
Next one, I'm scared of looking fake with Botox. Can I look natural and still get benefits?
Of course.
Yep.
Yeah. Fake with Botox, I think comes from, there are certainly some people out there that we see where you're like, that's not moving right. Why is your mouth not working? Why is nothing working? So like, there's a time and a place to go heavy-handed, and then when somebody is looking for a little bit more natural approach, to just like tone it down a little bit. One of my friends is a therapist, and it was really important to her to be able to like be emotional with her patients, to like really still have facial expression. Actors, they need to be able to move their face. So it's okay to drop the dose down if that's really important to you.
Yeah, and you might not get as long.
And that's always something that we talk about.
But that's okay. I think you can still get benefits, especially if you do a lower dose, because the consistency of the Botox is also key. Both of us are due for Botox, and you can see that we don't have deep lines, and that's just from consistency of Botox. But the Botox is worn off, but we've still reaped all of the benefits.
Right. So then that moves into thoughts on preventative Botox for some, maybe younger patients or baby Botox.
Okay, so I don't know actually if you agree with me on this, but I think that Botox in itself is preventative.
Yeah.
Like right now when we get Botox at 32 and 33, 34, you're about to be 34, it is preventative in reducing the deep static lines.
Yes.
However, if you are 25 or 23, 25-ish, and you don't have any static lines, I don't think that you need preventative Botox.
Yeah.
I just don't.
I think maybe if I'm seeing a ton of active movement still, we'll do it. Somebody who maybe doesn't have lines at rest, but they have thicker skin, deep lines when they're expressing, they're going to develop them quicker, and I'm okay to put it in there. I have some young patients. I have some young patients who have deep lines.
Yeah.
So it's not about an age thing. A good rule of thumb, yes, is if you start to notice a line at rest, that's a good time to start.
Yeah, you're right. I actually had a 30-year-old patient who doesn't have any lines, and she's like, "Should I get Botox?" And I was like, "Well, you're gonna love it, so sure,
Do
but
it for
also
the skin quality.
Do you need it? No. I was really hard on my assistant Maddie because she's 23 and she has wanted me to do her Botox, and I have made her wait, and I have made her wait. She does have a line there though, and so finally I was like, "Sure, Maddie." I think it was like, I was like, "I'll do this for your birthday or something."
She's got,
she's very expressive though.
Got a lot. Got good results from chin. She's RBF. It was good for her.
Yeah,
even though she was 23.
I think it's great. I want her to love herself as a 20. I just think that there's other things she could worry about too.
Yeah, and then baby Botox, I will do it very rarely. Baby Botox basically is a less amount.
Yeah.
For most patients, it's not appropriate because you're not going to get longevity from it. But again, there are just certain patients who I do want it to be less for, so I'll make an exception.
Agree. What areas besides the forehead and upper face can be treated with Botox?
The lower face all day, every day.
Yeah.
I love it for the corners of the mouth, the chin, the jawline. I really see my 40-year-old patients who are just noticing some laxity, and so doing some Botox along their jawline really does tighten their skin up.
It looks like you have a lifted appearance. It
Yes.
can't necessarily lift. But it does give that appearance that it's lifted because it's tighter.
Yes. So those are always those three areas almost on everyone late 30s and beyond. I say, let's bring your Botox down your face for sure.
And I don't know what's up with only treating the upper face when our lower face ages just as quickly, or if not quicker.
More. You'll see patients with that really pursed lower face, and it's just that hyperactivity of muscles. And if you put some Botox in it and relax it, they have amazing results before you even get to any filler.
And I am a big believer in Botox and filler being married. So if we plan to do some chin filler and I see you have a strong chin muscle,
Yeah, go ahead and do it.
I would do it.
And then masseters for sure, huge. Love masseter Botox. I love platysmal band Botox.
You can do it for trap muscles. We don't do that often.
No. Underarm sweating. I really should have taken advantage of that this summer.
Yeah.
And done it
Palms.
maybe in May. I've done my assistant's palms, and she said it hurt, but it really helped. So yeah, there's tons of areas that you can do it.
And microtox.
Yeah.
In
for
the neck.
pores.
Yeah.
Oh, yeah, for necklines.
Yeah.
Lots of different areas so you can do it. All right. What's the difference between lip filler and a lip flip?
A whole lot.
A lot.
Lip filler is filler, and so it's going to be more permanent. It's going to give you a ton more volume. It's going to hydrate your lips. Lip flip goes right into this orbicularis oris muscle, and it helps this curve in. So when we smile, some people curve in. I don't.
Yeah.
And so it everts that outer lip. People love it.
Yeah.
It goes away quickly because we can't completely... My patients will often say my lower face Botox as a whole goes away more quickly than my upper, and that is true. We can't obliterate your lower face,
Yeah.
or you won't be able to move.
We've
And
tried,
so
and you can't talk.
no, I've obliterated my chin, and it's hard to talk. So
there
take it from us.
Yeah, you can keep increasing the dose, but you're going to have some of those other negative side effects that come along with it. Versus doing a lower dose, getting maybe half of the time, it looks great, and just knowing that it's going to go away a little bit faster.
For my patients, your patients, anyone listening who has vertical lip lines or is seeing them start to be very faint, you need to put Botox there.
Yeah.
No question.
It really does help. Even if you do like micro Botox, and not like a true lip flip, you'll get some good benefit, and it won't necessarily knock out your whole lip there.
On the topic of filler, does filler migrate?
In some areas, yeah. And maybe it migrates more than we think. I hate that word migration, but it kind of just, if it's done inappropriately, it's not that in a lip, yes. Can it migrate outside of the lip? Absolutely. In the tear trough, I don't know that it's migrating. It's just placed poorly. And eventually over time, it's going to swell and bring in water, and it doesn't look good. There was a study, though, that Nicola Lowry posted, and maybe it was Leonie Schelke, where they looked at 100 cases of cheek filler, and all 100 had migrated into the temple.
But only the zygomatic
The lateral
cheek.
zygoma,
We treat cheeks medially, so this
back
bone
part,
right here,
if you inject it all the way back, which, again, not a lot of people even need, but 100% of the patients with that ended up in their temple. Not a bad thing.
But I was going to say, most people end up needing temple filler anyway, because they get hollow there. The more hollow you are, the more gaunt you look, the less youthful you look.
Right.
So I don't necessarily think it's a bad thing, but I remember her telling us about that study.
Just shows that, sure, it's not necessarily, it moves, yes, but it's not that, this cheek filler is not going to end up all the way down here. Yeah.
Your cheek filler
it's not walking around your face.
Yeah, and like Lauren said, I think you said it perfectly, is if it's placed correctly, if you use the right product, if you don't go overboard, if you respect anatomy, then it will pretty much stay there. And what we've actually found out in the past few years, especially with that viral MRI study, is that your filler is lasting. Guys, this is a good thing.
Yeah, we're happy about this.
That your filler is lasting. You don't have to go every year or 2 years and spend $5,000 on a full face of filler. So,
and then on that topic, how can I avoid looking overdone with filler?
Well, I think what I just said is respecting the anatomy, going to an injector that you trust, someone who looks natural themselves, I think is important, and not overdoing it. That's how you can avoid looking overdone, is not overdoing it. Your injector should be able to guide you. Look back at photos of yourself. That's a great way to do it. Look back at photos of yourself. If you are trying to literally change your face, I think that's a sure way that you will look overdone.
Yeah, definitely.
Do you agree? Do you have anything else to add?
Yeah, no, I think that everyone is different. Everyone's anatomy is different. When we start saying everyone needs 5 syringes in these 5 areas, you're going to start to all look very similar versus my plan is different for every single patient who walks in, depending on what your anatomy looks like. So yeah, just having somebody who can look at your face and say, this is your face shape. This is the areas where you're deficient in. This is where we're going to fill. This is not where we're going to fill, because you don't need it there.
And we had a great conversation yesterday with Nina Burdett, who was talking about facial shapes.
Yeah.
And how every facial shape is different. And so some people who have, these elongated faces, they don't need chin filler.
Right. Absolutely not. You're going to just make that worse.
Yeah.
Or make it appear longer. We're just trying to keep things proportional to you, and that is different for every single person.
I agree. Okay, why do people call Sculptra the 401k for your face?
Okay, so I think it's because
and I love that analogy, by the way.
I know. So your 401k is what you put into every single month, and then it's growing over time. Sculptra is the same thing. You're putting it in, you're injecting it into the face, and it's building collagen over time. So I like it for skin quality, skin laxity. It really improves the appearance of the skin, and I love it for just a little looseness in the skin. To me, I hate to use the term lifting and tacking back, but it has that appearance because it's thickened and tightened it up.
Yeah,
and it
agreed.
looks so much better. And so, but it is a slow build. It's that thing that you're putting in, and you're not necessarily seeing like the growth right away, but over time, you love it.
Not instant results, but over time, it's sort of like your collagen banking, just like you're banking your 401k.
Exactly.
It's going to be that sports bra for your skin.
So that is a cool analogy.
Yeah, I love that. So, with Sculptra, how many treatments will I need? I think everyone is a little bit different in this. A 50-year-old is going to differ from the Sculptra we do on Lauren. But typically, and we've kind of gotten away from saying this, you need a vial per decade. We, in our practice have actually realized that you need more.
I think a little bit more.
Yeah.
So maybe like the vial per decade plus one or two.
I agree.
I at 34 probably don't need 3 vials right now. I have good skin. I take care of my skin. I do other injectables. I do other skin treatments. So maybe 1 or 2.
But in your early 30s too, it's so great for you, like we were talking about earlier in a different episode. You have to step up those treatments because you do such great skincare. You're doing the in-office procedures. Anyone in their early 30s should start thinking about a session of Sculptra per year.
Yeah.
Like that's what we've done on you.
And then somebody who's in their 50s and hasn't done anything, or maybe they are taking good care of their skin, but they're having some laxity. I tell them like probably, 5 vials at least. But we'll kind of see. If I see great results with 4, let's stop and we'll pick back up in the year and a half or so.
And there's a lot of Sculptra controversy, facelifts. We're not going to get into that right now, but if you have questions about whether you can have Sculptra and get a facelift, DM us.
Yeah, for sure.
We'll answer it there.
How many laser sessions do I need to see results?
This is hard. I think it truly depends on what your skin looks like. Do you take care of it? Is this your first time stepping into a med spa?
General rule of thumb, though, I tell new patients 3.
Yeah. Yeah, I mean, I guess like with the BBL Moxie, you need 3.
Even with a cool peel, you need 3.
Yeah.
Microneedling, you need 10. But
I was just thinking
let's start with 3.
I was just thinking like, I haven't done my yearly CO2 yet, but for us,
that's 1.
That would be 1.
If you are a patient who is on top of your skin treatments and it's maintenance, I tell my patients 1 to 2 laser treatments per year for maintenance. If you're just starting out and we're really trying to tackle concerns, let's do 3 consistently back to back.
Consistency is key. What about RF microneedling? What are your thoughts?
I know. So
I still like RF microneedling. I had a patient say, "Oh my gosh, RF microneedling is out," and I was like, "It's
out.
not. It is all dependent on what hands the procedure is in. Like
generally, it's out for me.
I mean, it's painful if you don't have good numbing cream, but
I think
that there's a time and a place. I still think like the idea of RF microneedling is great.
I'm out. Sorry.
Okay.
Okay.
That's fine. I just think that it can be out for you for reasons that I know is not what's circling in the internet, which is I was burned by it. I lost a ton of fat. Because we're not
that's not why it's out for me.
You
it's
have
out
to
because
know,
it's painful.
Yes,
it's
like
out
I knew
because
that.
you can get results with things that are less painful and with less downtime.
Yeah.
But
I just wanted to clear that up.
Thing. Yeah.
It's not because my patient was like, "Oh my gosh, I saw this girl. She, over time she looked back at pictures and she didn't have any more of her facial fat." And I was like, because her provider didn't know what they were doing.
Yeah, did bad settings.
Yeah.
But in general, it's just not the tool. I am not reaching for that tool for my patients.
Yeah, I think.
Therefore, it's just kind of phased out for me. Okay, this is a hot question. Why is everything so expensive in aesthetics?
Can I put in a little story that I was just telling you earlier? Okay, so on TikTok, there's these DIY Botoxers and fillers.
Yeah.
Or like people injecting themselves. So I made like a stitch video.
Yeah.
And I've now had people comment saying, well, if you guys didn't charge $500, then we wouldn't have to DIY.
Right. So let's break down and go into why is it so expensive in America, right? Because you can go to Europe and you can go to Korea and Japan, and these products are less expensive, but the reason that they start so expensive is because of big pharma controlling the cost.
I mean, y'all, like we have to pay for the bottle of Botox.
It's
like
$535.
The margin for us is actually not that great.
So these products are expensive from these pharmaceutical companies. Like, they are charging us a ton of money.
And it's a business.
And so you have the product, okay? You have the supplies of the product. You have to have needles, gauze, alcohol, all these things. You have the injector who has been trained, knows what they're doing. You have the lights of the building, the rent of the building, the assistants who are working there, the receptionist, the EMR. There's so many other costs involved. But yeah, like you're saying, that margin is quite low when you actually break it down. So that's why it's so expensive. It really starts from the top. But then really, like we've said, in order to get great results, you have to go to somebody who's going to do great work.
Mm-hmm. Yeah. The DIY Botoxer that I replied to her whole entire
lid was shut.
She looked like she had a stroke because not only did she drop her lid, she dropped her brow. So you're telling me you would rather that?
Right.
You would rather that result over.
Unless,
she even said we can pay $200 and do it ourselves, but you guys pay $500. And so now that she's stuck with looking like she had a stroke for 3 months, you'd rather save $300 for that result.
And also, let's just remind ourselves that this is a choice. This is an elective procedure, but it's also a little bit of a luxury. Not everyone can go around and buy Louis Vuitton and Gucci either, but there are people who do it. And so there are ways that you can save for procedures. There are ways that we can, make it more accessible. Mm-hmm. But at the end of the day, if it doesn't fit your budget, then just come back to it when it does.
Agree.
And that'll keep you safe, because also there are people having anaphylactic reactions. They're being hospitalized. They're dying from injecting these things.
There was someone who died in Atlanta, right?
Not too long ago. Yeah.
Crazy. It's not worth it. It's just not worth it.
Right. Just buy some over-the-counter skincare and start taking care of your skin and wearing sunscreen, and you'll be great.
Do us injectors get all the treatments we're recommending to patients?
I think that I get a lot. I get a lot of treatments, but just because I don't do something doesn't mean that it's not for you, right? I don't need under eye filler. So I'm not going to go get it just so that I can tell you that I've had it.
Yep.
I don't necessarily need chin liposuction. So I'm not going to go get it just so I can say that I've had it done. And same thing when it comes to products, skincare products. If I don't use a product, that doesn't mean it's not a great product, but every product isn't for every person.
Agree. But we're not going to recommend something to you that we don't believe in.
No.
I think that's the big one. Okay, last question.
Okay.
What can I do for jowls?
So, if it's early, because I feel like I have a jowl. If it's early, Botox.
We talked about how monumental and transformative lower face Botox can be.
So, if it's early, Botox. If it's early, Sculptra, a little jawline and chin filler to kind of conceal it and hide it, and then ultimately surgery.
Yep.
Depending on that degree, because you've seen these patients, we've seen them, you've seen your moms and your grandmas and all of that really heavy skin right here at the corner of your mouth. Think about if you have to fill to get it even. Now you're just full and puffy.
Yep.
So you can't fill to just completely even it out, or it looks bad.
Yeah,
so
I agree.
It's really, I think you have to consider surgery.
Yeah, and there's so many anatomical structures involved with you getting a jowl. And so if you're seeing a true jowl, then at that point you're probably ready for a neck lift or facelift. And that would be in your best interest.
Absolutely. It doesn't matter about the age. I've referred a 38-year-old to get a lower neck lift because she had lost a lot of weight. She had so much loose skin, and there wasn't anything that she could spend her money on wisely with me that was going to make an impact. And I don't want her spending $5,000 on something that's changing by 20%. It's
Agree.
just not worth it.
Agree. We would never.
So we have a million more questions.
To go we didn't get through the whole list.
So if your question didn't get answered, put it in the comments. If it's something that you really want to know about, let us know. And we'll do a part 2 and run through all the rest of these next time and collect them. But Until next time.
Bye.
Bye.